Have you witnessed someone you love suffer from dementia? If you have, I'm sure you have had the great displeasure of watching someone you care for slowly fade away. If you haven't, I'm really sad to say, but the chances of you experiencing this in your lifetime are very high. 16 million people in America care for someone who has dementia. And family caregivers spend an average of 5 hours a day providing care for that family member with dementia. I have been a certified nurse's aide for 6 years, and I have experienced the difficulties of caring for an individual with dementia or another cognitive impairment, both professionally and personally. Caring for an individual with dementia can be challenging, but understanding their perspective and learning tips and techniques will improve communication and interaction between the caretaker and the patient. 5.8 million Americans suffer from dementia, according to the CDC. Almost 10% of those cases will occur in people ages 30 to 64. This is called early onset dementia. Contrary to what many believe, dementia is not a specific disease, but a term used to describe a group of symptoms that affect memory and judgment. Alzheimer's, on the other hand, is a common disorder that atrophies the brain and kills brain cells. While Alzheimer's is the leading cause of dementia, it does not mean someone who has dementia necessarily has Alzheimer's. There are a variety of other illnesses and diseases that cause dementia, stroke and other brain injuries, Parkinson's disease, ALS, even severe infections. It's recently been noted that severe cases of COVID-19 can cause patients to have COVID dementia. Common symptoms of dementia can be broken down into 5 main categories: cognitive, mood, psychological, muscular, and behavioral. Behavioral symptoms can be some of the hardest symptoms to manage as a caregiver. These include irritability, lack of restraint, which can present as being physically, verbally, and sexually inappropriate, wandering around or getting lost, and mood swings or personality changes. Having knowledge about a patient's history can make understanding, de-escalating, and sometimes even preventing these behaviors possible. For example, let's say you need to help Marianne with a shower, but as you're getting her into the shower, she starts yelling and slapping your hands away. If you had investigated Marianne's history beforehand, you would have noticed that she was previously the victim of a sexual assault, and showers really trigger that trauma response for her. Once you know this about her, you can take extra steps to prevent this from occurring. Knowing a person's history doesn't just help prevent behaviors, but it helps you understand why they react to certain stimuli the way that they do. There are a variety of causes for someone with dementia to have behavioral symptoms, and sometimes it seems there's no reason at all. The main causes of behaviors are environmental triggers, past trauma, and unmet needs. Environmental triggers would be like if they're too hot or they're too cold, or if the lighting in a room is too bright, or if noise around them is too loud. So most of the time you can just visualize what they are responding to. Are they flinching? Are they shivering? Are they cold? Are they squinting like the light is too bright? Are they covering their ears because things are too loud? Adjust their environment to something more comfortable for them. Get them a blanket, dim the lights, reduce the background noise, whatever you need to do. Another big cause for behavioral symptoms is unmet needs. If the person is hungry, if they are tired, if they need to use the bathroom, all of these triggers are difficult for a person with dementia or other cognitive impairment. they can't really manage these things on their own anymore. And especially when they lose the ability to communicate these needs, it makes it very frustrating and hard for them to act appropriately. Dementia is caused by a variety of illnesses, and the behaviors associated with it can vary from person to person. But there are techniques that can make caring for an individual with dementia easier both on the caregiver and on the patient. One of the biggest, one of the key things to caring for someone with dementia is actively trying to learn their history and what their preferences are and just all around who they are, what they're going through, and where their mind's at. Once you have that knowledge, you can improve your interactions and give both you and the patient a better experience. Sadly, many of us will experience dementia at some point in our lives, whether it be a parent or a grandparent or even a spouse. But knowing some of these tips and tricks and how to better communicate with people with dementia and understand them will make a significant impact if and when you have to experience it.